All right, everybody, the numbers are still rolling in as far as people who are attending. But we're going to go ahead and get started. So my name is Stephanie Freeman. I am the Memory Center Program Coordinator here at the Norton Neuroscience Institute's Memory Center. Very excited to have with us again Dr. Rachel Hart. And welcome to everybody again who has attended the last two presentations from Dr. Hart. Very, very nice presentations, great information as always. And if this is your first, I think you will greatly enjoy hearing her expertise and knowledge on this subject. So Dr. Rachel Hart is a board certified geriatrician with specialized training in memory care with Norton Neuroscience Institute's Memory Center. She graduated from medical school at the Ohio University Heritage College of Aesthetic Medicine. She completed internal medicine residency at the Christ Hospital in Cincinnati, Ohio, and completed her geriatric medicine fellowship at the University of Cincinnati, the Christ Hospital program. As a geriatrician, she has training in caring for older adults in the setting of outpatient geriatric assessments, inpatient consults, geriatric rehab, long-term care, and geriatric house calls. So again, thank you, Dr. Hart, for joining us, and the stage is yours.
Well, thanks for the introduction, and thanks for everyone for attending today. As Stephanie mentioned, my name is Rachel Hart, and I work with our patients in our memory center here at Norton. I wanted to spend some time this morning talking about how someone living with dementia, how that dementia impacts their ability to make decisions, and how we as caregivers and family members can help support them. So dementia impacts a person's ability to make decisions because the disease affects the parts of the brain that are involved with remembering, understanding, and insight. Dementia doesn't always mean that a person lacks capacity to make decisions, but because dementia is a progressive disease, decision-making capacity changes over time. And hopefully by the end of this presentation, we can learn ways to help those individuals to keep making their decisions as long as possible, and how we can better support them when they aren't able to make those decisions. So during this presentation, some of the things we'll talk through: learning important definitions of medical ethics, especially capacity and competency, recognizing conditions that impair capacity, identifying complex questions of capacity, understanding the meaning of advanced directives and how to complete them, and understanding how dementia impacts decision-making, but how a caregiver can support the individual with dementia when they can no longer make their own decisions. So first, I just wanted to go through some medical ethics that medical providers, physicians or nurse practitioners or physician assistants all learn during training. But for medical ethics, capacity means an individual's ability to make an informed decision. An example of that would be an individual who can give consent to a surgery. Competence is a degree of mental soundness that's necessary to make decisions about specific issues and carry out specific acts. Competence is a legal term that is judged by a judge and jury, and we'll talk through what the difference between these two are more in detail later. As medical providers for our patients, we want to recognize and allow them to have autonomy. That means requiring that a patient is independent in thought, intention, and action when they make their decisions regarding healthcare. So regardless if that decision is a good or bad decision, a patient who has autonomy has the right to make those decisions. As a healthcare provider, our goal is to be beneficent, providing treatment with the intent of doing good for a patient, but also practicing non-maleficence. We want the procedure or a treatment that we're proposing not to harm a patient, but also not to harm others who may be involved in society. So the big difference between capacity and competency is who judges each of those. There's a lot of confusion about these two topics, both with patients and caregivers, but also within the medical community. But capacity is based on a clinical judgment and is performed by a clinician. So mainly a physician, a nurse practitioner, or a physician assistant. but it's really the ability to make the decision in the context of one medical decision. So an example of me judging someone having capacity would be discussing with them a severe case of arthritis in their right knee, and they need a knee arthroplasty or a knee replacement. I can do a clinical interview and make a judgment on whether that patient has the capacity to consent to that surgery. Competency, on the other hand, is a legal judgment, and that's really determined by the court. An individual who has severe cognitive impairment and who's shown evidence that they're unable to provide self-care or manage the care of their self actually goes before a court, and a judge determines that that individual lacks ability to make decisions for their medical care. And instead, they assign a guardian to make those decisions for them. So capacity, when a medical provider or physician judges someone capacity, again, this is generally done during a clinical interview. And individuals who do have decision-making capacity meet 4 key criteria. And those are understanding, expressing a choice, appreciation, and reasoning. And some examples of how this would be judged, we can look back at that individual who needs a knee arthroplasty. That patient can show me that they have understanding if, after we discuss their case, they're able to then tell me in their own words the relevant information, the diagnosis of knee arthritis causing pain and limited mobility in the knee, and that we've discussed having an orthopedic referral to have a surgery to replace their knee. And then they can also tell me the risks and benefits that we can go through. That person can illustrate that they can express a choice, mainly by just having the ability to state their decision. So based on what we've discussed earlier today, do you think a referral to orthopedics would be a good decision for you? And if the patient wants that referral to orthopedics, they've expressed their choice. A patient can illustrate that they have appreciation by really having the ability to explain how information applies to themselves. So that individual, again, after we discuss their options for a knee replacement, can tell me, what their diagnosis is. Their diagnosis is arthritis causing knee pain and limited mobility, perhaps falls. But they can also appreciate what kind of benefit they can have from a surgery. If that person can tell me, based on what we've discussed, I know that the knee arthroplasty is going to be my best option for getting rid of my pain and also improving my mobility to where I can walk better independently. They can appreciate that the benefit from that surgery. That person also needs to have the ability to appreciate risks from surgery. And they can illustrate this by identifying potential risks from surgery, things like anesthesia, potential bleeding risk, or infection risk. And then the last criteria they have to meet is the ability to reason. And that's the ability to compare information and infer consequences of choices. And the individual can then identify or illustrate that they have reasoning based on how they've made their decision. So when we look at the option of having a knee arthroplasty versus not doing surgery and maybe going alone just on pain control, which one of those would be better for you? A person who can weigh the risks of consequences and the risk of a benefit can say, well, my better option would be, if I want to maintain mobility, I need to have surgery. They can show what was important to them when they made that decision. And as healthcare providers, again, our responsibility is to respect a patient's autonomy, but also to practice beneficence. Unless proven otherwise, if a patient has decision-making ability, we assume that they have autonomy. So again, whether a decision is a good decision or a bad decision, patients who have autonomy have the right to make those decisions. And then as a physician, our ethical responsibility is to do right by patients. So this is important when we take care of patients who have dementia or cognitive impairment, because they have limitations in their memory and also in their ability to understand. Trying to get a person through an interview usually shows that they have a hard time either understanding concepts, medical diagnoses that they have, but also appreciating the risks and benefits of surgery. They have a hard time looking into the future and making a future plan. So our responsibility, again, we want to do right by them, but we also want to make sure that we protect that patient from consequences of bad decisions. So what kind of conditions do impair capacity? And we've talked about probably the biggest one, which is neurodegenerative diseases. And those are our dementias, our Alzheimer's disease, our vascular dementias. It also involves traumatic brain injury, patients with psychiatric illnesses, including schizophrenia, bipolar disorder, and major depression. All of these psychiatric illnesses can compromise mentation or memory and can also impair capacity. And then a large group of our older adults who are in hospitals, so hospitalized older adults, are at risk for compromised mentation or compromised capacity. And that may be from cognitive impairment that's related to chronic diseases. People who have COPD or emphysema already have high levels of carbon dioxide, low levels of oxygen. When they're hospitalized, that tends to be worse, and that can impact their memory. Our patients who have delirium, which is an acute altered mental status during a hospital stay related to their medical illness. So because they're so sick, whether that's an infection, whether it's from a surgery, as a part of that disease state, they often are more confused than they are at home. And then there are a lot of medications that are introduced during a hospital stay that can have side effects that impact memory. Those are things like some of our nausea medicines or some of our pain medications. And then there are also questions of complex capacity regarding dementia. If we look at questions of capacity, decision to consent to surgery like a knee arthroplasty may seem much more simple than some of our other questions involving capacity when it comes to dementia. And some of those complex questions are going to be things like financial capacity, certain medical treatments, and also end-of-life care. So financial capacity is the ability to independently manage one's financial affairs in a manner consistent with personal self-interest. And the lack of financial capacity can have dire consequences. So an individual who has dementia struggles with short-term memory loss. It's not uncommon for them to have difficulties remembering to pay monthly bills. So things, utilities like water bills, electric bills, things that need to be paid each month. If enough months go by where those bills aren't paid, those utilities can get turned off. There's also consequences of things like mortgage payments or taxes that go unpaid. And then individuals who live with dementia are also more vulnerable to scams and financial exploitation. Individuals with dementia are much more likely, if they receive a phone call from an unknown number saying that our grandson in Georgia got in trouble, he's in jail, we need you to send or wire a large sum of money to get him out of jail and get him home, that concerned individual is going to want to help their grandchild, and they may give out too much personal information and allow someone to take advantage of them. There's also a lot of people who fall for scams related to things like donating money to charities. People call, email, send things in the mail requesting money for a charity. It's not uncommon for sometimes that financial problem to happen where people are giving or donating hundreds or thousands of dollars a month, some to legitimate charities and some to things that are not real charities. And then I think another important point is that for a lot of people, this lack of financial capacity may be the presenting symptom that someone may have an early stage of dementia. And so if someone seems to be doing well, meaning they seem to be independent, their memory seems okay, but they're a victim of a scam or financial exploitation, it is important to consider having a cognitive assessment for them. So how do we address financial capacity? And really it involves planning for it early. So you want to have a financial power of attorney executed and in place. And once that document is completed, that power of attorney can take effect immediately. There are also elder law attorneys, some of them who work with financial planners and some financial planners who work independently. But these people specialize in helping older and cognitively impaired patients by doing things like estate planning or setting up trusts. And then there are practical interventions that family members and caregivers can do, considering things like online banking. When the banking's done online, there's a paper trail, easy for a caregiver to access and see where that money is coming in and going out of an account. There are also things like automated bill pay. So those things that, those bills that are recurring monthly or recurring at routine intervals, things like utilities, a great way to make sure that they're paid on time. There's also options of joint bank accounts. So if someone does have a diagnosis of dementia, it's a good idea for a family member or caregiver to have a name on that account as well. That way, if there are large sums that are taken out, they get notified of that. If someone is the victim of a scam, that family member or caregiver on the bank account can also work with the bank to help write that. And then a lot of banks do offer overdraft protection. A lot of them will charge a small fee, but if a bill needs to get paid, they can cover the cost of that to make sure that individual doesn't get into trouble. And then again, our elder law attorneys can help set up things like living trusts that families can help an individual manage. And then regarding questions about medical care and end-of-life care, our best option or our best way to provide protection for our individuals with dementia is really completing advanced directives. And this can help with answering questions regarding medical treatment and end-of-life care. Advanced directives are legal documents that an individual completes when they are of sound mind, when they are making their own decisions, when they do have capacity. And they complete these directives and have things done in writing. After they're completed, they're put in a safe place, a safe deposit box. Their family member is given copies of them. Then they stay there until a condition happens where they lack capacity, where that's taken away. And those advanced directives can come into play then. When we complete advanced directives, those are things like assigning a power of attorney, completing a living will, and for some patients, completing a MOST form, medical orders for scope of treatment. So a power of attorney lets a person transfer authority to another individual to manage and transact their business or medical affairs. These types of forms can be useful if a person is expecting to be unavailable for a period of time, has a transaction they'd like someone else to handle for them, or wants the protection of someone by their side making medical decisions if they're not able. And it may seem obvious, but it is important that a person who's chosen to accept this authority is someone that an individual trusts. And Kentucky recognizes 3 types of powers of attorney. The 3 in Kentucky, the website or web address listed at the bottom, if someone's interested, is a way to access the forms for these. But a Kentucky Advanced Directive is a type that allows you to choose an agent to represent your healthcare interests. So you choose a healthcare surrogate, and it combines a medical power of attorney and living will all into one document. There's also a durable power of attorney, and that's completed with an individual and an attorney. And that durable form allows a person to convey financial authority to another. This power continues unless it's revoked by the individual, even after the individual may be declared incompetent. And then a general or financial power of attorney is similar to the durable power, and that it conveys the financial authority to another, and it does continue until it's revoked by a patient or individual. But if a person is declared incompetent in a guardianship trial, this financial power of attorney becomes invalid. And then a living will gives you a choice or gives you a voice in decisions about medical care when you are unconscious or too ill to communicate. As long as you're able to express your own decisions, your living will is not used. You can accept or refuse any medical treatment that's offered to you. But if you become seriously ill, you're unable to speak for yourself, and you lose the ability to participate in decisions about your own treatment, the living will is accessed, and those types of treatment that you want done will be done on your behalf. In Kentucky, a living will allows you to leave instructions in 4 critical areas. You can designate a healthcare surrogate, so a substitute decision maker, power of attorney. You can refuse or request life-prolonging treatment, things like mechanical ventilation or breathing machines. You can refuse or request artificial feeding or hydration, so things like feeding tubes, and you can express your wishes regarding organ donation. And then some patients will also complete a form called a MOST, or a medical order for scope of treatment. A MOST form describes your wishes for healthcare in an emergency. A MOST form includes directions about life-sustaining measures, so things like CPR, but it also includes, in addition to that, decisions about intubation, breathing machines, antibiotic use, and then feeding tubes. The MOST form is a single-page document that can help medical providers understand your wishes at a glance. And a MOST form that is completed does serve as a physician order, so those things will be enacted for you. A healthcare professional can help create a MOST form if someone enters a medical facility, such as a hospital, a nursing home, or a hospice care facility. And it is legally valid only if it's signed by you or your healthcare power of attorney or decision maker, and if your doctor signs it. In Kentucky, a MOST form is printed on brightly colored pink paper, so it stands out on any medical record. And that form travels with you from one healthcare setting to another. It would go from a hospital to a nursing home, from a nursing home to a hospital. And again, when it travels with you, it serves as physician orders. And this MOST form can be changed by an individual or canceled at any time if their decisions change. And then because we're talking about decision-making capacity, I did want to talk through the guardianship process. And the reason why we stress or we try to have patients complete healthcare powers of attorney in advance, or meaning when they are able to make decisions, a healthcare power of attorney is a much easier process than pursuing a guardianship. And we want to try to avoid guardianship when able. And for most people, formal guardianship isn't necessary, but a guardian, again, is a court-appointed individual. It's based on a legal determination that a patient is decisionally incompetent. So someone who does have cognitive impairment and has shown evidence or concerns that they are not able to provide self-care, again, go before a judge and jury, and there's a legal determination that they cannot make decisions for themselves. So someone else is appointed to make those decisions for them. In Kentucky, a guardianship is initiated usually for one of the following reasons: an adult who's unable to meet his or her own daily needs due to profound mental illness or dementia, things like bills going unpaid, starvation, poor hygiene, or incidences of wandering, or leaving the house and coming into the street, allegations of abuse, neglect, or financial exploitation by a caretaker, an adult diagnosed with a mental retardation, serious accidents that results in trauma to the brain, impacting the person's ability to care for him or herself, or an individual who has frequent referrals to adult protective services, again, for concerns that they're not providing their own care. Guardianship is a legal relationship between a court-appointed adult who assumes the role of a guardian for a ward. An award is a person who's been declared legally disabled by the court and is no longer able to care for his or her personal and/or financial needs. A guardianship allows someone else to make ongoing decisions on their behalf if that adult is declared incapacitated. A guardianship does involve a high emotional cost, both to an individual and to a family, or to a caregiver or an individual who's pursuing guardianship. And it also has a financial cost with court fees alone up to $1,500. So guardianship, much more expensive and a higher toll physically and emotionally. So again, guardianship is much more involved and a much more difficult process than a power of attorney. And for most people who have things like a durable power of attorney in place, a guardianship can be avoided for them. The steps involved in the guardianship process usually begins with an application or a petition that's filed and reviewed by a county attorney's office. If it's approved, a trial is scheduled within 60 days, and the court requires an individual to be examined by an interdisciplinary team, and that team is chosen by the court and made up of a physician, a social worker, and a psychologist. And that interdisciplinary team creates an evaluation to report to the court. Guardianship in Kentucky does require a jury trial, and juries have to decide financial and personal affairs on behalf of the respondent. So for each issue, juries will determine either a no disability, a partial disability, or a full disability. And then how we can support this individual with dementia who lacks decision-making, I think is important to identify again that power of attorney. But dementia is a progressive condition, and as dementia progresses, it leads to a loss of cognition, a loss of ability to perform activities of daily living, things like bathing, dressing, and toileting, and it leads to a loss of body functions, so someone's ability to fight infection or to swallow. And although dementia lasts several years for most patients, it is a condition that ultimately leads to death. The most common cause of death in advanced dementia is usually the inability for the body to fight infection or to lose the swallowing ability. So with dementia, it is best to complete a power of attorney and living will as soon as possible. When these documents are completed in the early stage of dementia, the individual living with dementia can often participate in as many decisions as possible. And having these decisions in writing as legal documents can help with difficult decisions that a power of attorney or a surrogate will have to make at the end of life. So advanced care planning really should involve starting a conversation early before the individual loses capacity. This allows an individual to participate and articulate their wishes. And it should always be encouraged for an individual, whether they have dementia or not, but certainly if they have dementia, they need to be advised to appoint a healthcare proxy. So when something happens, when that dementia progresses to an advanced stage, they already have a substitute decision maker or a surrogate who can make decisions on their behalf. And these conversations about advanced care planning are very difficult to start, they're difficult to initiate, and they can cause things like sadness and questions about, are we doing the right thing? The conversation, there are physicians and social workers who are trained to help families and patients identify important decisions to make and can give some guidance on how to get these documents completed. There's also something called the Conversation Project, which is an initiative from the Institute for Healthcare Improvement. And this is a free initiative that's available online, and they created a website that's available to individuals, patients, and families. Places the emphasis on having a conversation on values. So what matters to a person, what matters to you, and not what's the matter with you. The goal is really to help people share their wishes for their care through the end of life, giving some guidance for initiating a conversation. How do we start the conversation to talk about what's most important? And how do we initiate the conversation of, well, now that we've identified these are important things for you, we need to complete this living will. We need to complete a power of attorney. And those guides are things that are guides for how to have a conversation with families, but also guides on how to begin the conversation with healthcare providers. And then the web address listed on the bottom is just how to access that conversation project. And I think that was everything I had for today. So if there's any questions, I'm happy to answer them.
Thank you. Always good information. That's a heavy topic, and it's something that I think is important for everybody to have the knowledge that you shared, especially, those definitions can be so complex. But the practical information and tips you gave, I think are very helpful. I did have somebody raise their hand to ask a question, but I haven't seen it come through yet. Oh, here. So Sherry said, will you please share your slides? And so these will be available. It's being recorded. So if we could, we will be putting these on the Norton Neuroscience Institute's YouTube page. And then I believe could be emailed out to attendees as well.
I think that's what we did the last time.
Perfect. Another